Ay, wait. Yung mga picture niya. Alam ko na. Pag PowerPoint, meron akong pointer. Nakikita niyo ba yung pointer? Hindi.
Yes po, Doc.
Yes po, Doc.
Yes po, Doc.
Pag doon sa keynote, walang pointer, no? So, yan, no, if you can just try to look at the picture, yung sa red is the parasympathetic and then sa blue is the sympathetic. So let's just try to focus on the picture, yung photographic memory. So yung sympathetic is coming from T1 to L2, hanggang L2 lang. And then the output just go out from this level of the spinal cord and then it will just go up and down para lahat ng organs naman masuplayan. But look at the parasympathetic. Galing lang siya sa cranial nerve. I mean, the output is out in cranial nerves 1972. Yan yung mnemonic ko in 1972. 1973, sorry, 1973. And then sacral 2, 3, and 4. So, kailangan nyo siyang tandaan yung ganyan. And it supplies internal organs. So, lahat ng internal organs. Okay. So the autonomic nervous system is part of the peripheral nervous system, which controls the visceral functions of the body. It's amazing. It has a rapid and specific effect. Let's say the blood pressure can decrease in a matter of 10 to 15 seconds. Ganun siya milliseconds. Ganun siya kabilis. It can even cause fainting. The heart rate can also increase in 10 to 15 milliseconds. Ganun siya kabilis. Kunwari, yung pakalasan ka, biglang your heart rate will increase. So it has an effect on gastrointestinal motility and secretion. Let's say you smell something appetizing, you will salivate and some of the gastric juices will be released even before you it. Ganun siya. And then, for example, yung bladder mo, if it's full, the sensory nerve fibers will be stimulated, send signals to the sacrum, sacral spinal cord, and then parasympathetic output, which will contract the bladder, and then the urinary sphincter will be relaxed so that we will urinate. Ganun din pag stool, a lot of stool in the rectum, diba? The rectum will be dilated and then sensory signals will be stimulated. The parasympathetic output via the sacrum 2 to 4, and then it will cause peristalsis of the rectum, and then the anal sphincter has to relax, and then you will defecate. Then when you exercise, you will sweat, and then there is of the autonomous nervous system to maintain a body temperature. An increase to the temperature will increase metabolism, and then decrease to that will decrease metabolism. So this is activated by centers in the spinal cord, brainstem, and hypothalamus, and most of its processes are in subconscious level. So mga reflex yan, yung baroreceptor reflex, if there's an increase in blood pressure, the arteries are stretched, the arch of the aorta and internal carotid are stretched, and then the baroreceptors are stimulated, send signal to the brainstem, inhibiting the sympathetic activity and exciting the parasympathetic activity, the parasympathetic output, so that the blood pressure will go down. So it's a subconscious level. There is another reflex, very important in our sexual activity. For example, you male will see a beautiful girl, so there will be parasympathetic activity causing erection. That's in the subconscious. But all these reflexes also send signals to the cortex. So you will have a conscious level. Pero when we say reflex, nauna yung reflex. And then what will follow is the conscious level. Parang di ba yung knee jerk, pag-stimulate ka, mag-move leg mo, that's a reflex. But later on, you will realize that yes, nag-move yung legs mo. So reflex is sobrang bilis, that's in a subconscious level, and then the conscious level will just follow later. Efferent output of the sympathetic and parasympathetic, the efferent output of autonomic nervous system is via the sympathetic or parasympathetic, and this will be the bulk of our discussion. Medyo mahirap siya kasi na minsan naman lumalabas lang siya sa exam, and in clinical practice, all we need to understand is the function. But the anatomy, we still have to memorize it because it will come out in exam. So both sympathetic and parasympathetic has preganglionic and postganglionic. But let's tackle first sympathetic nervous system. So preganglionic, meaning to say that there is a neuron coming from the intermediolateral horn of the spinal cord from T1 to L2. It will go out, and it will synapse with the second order neuron, which is the postganglionic neuron. So yung synapse is located in two. One is the sympathetic chain ganglia. So take note when we say ganglia, these are cell bodies outside the central nervous system. So because the cell bodies of the second order neuron is in this area, so we call it sympathetic chain ganglia. Most of the sympathetic neurons is coming out in the sympathetic chain ganglia, but some will not synapse with the second order neuron in the sympathetic chain ganglia, but with the peripheral chain ganglia. This peripheral chain ganglia is nearer to the organ that is to be stimulated. So meron tayong celiac, mesenteric ganglia. Again, ulitin ko lang, almost all naman is in the sympathetic chain ganglia, but some will go to the peripheral chain ganglia. So yung sympathetic chain ganglia, this is near the spinal cord, about less than 5 centimeters. But it is yung origin ng sympathetic neurons is coming from T1 to L2. Pero yung sympathetic chain ganglia, from cervical to sacrum yun. Okay, so having talked about the exit of sympathetic neurons in the spinal cord, the postganglionic neuron can originate either in one, the sympathetic chain ganglia, or two, in the peripheral ganglia. Now, yung chain ganglia, yung sympathetic neuron will go out through the ventral root. Pag dorsal root kasi sensory yon, so yung motor fiber, so sympathetic neuron is a motor fiber. There is also a sensory to that, but when we talk about sympathetic neuron, this is a motor fiber, so it will go out into the ventral root, and then it will have a U-turn, okay, dadaan yan to the right ramos in the sympathetic chain ganglia. So in the sympathetic chain ganglia, it can either synapse to the second order neuron or postganglionic neuron at that level. Say, for example, T1, it will synapse at T1, or it will go up to C6 and synapse with the postganglionic neuron there, or it can also go down, let's say at T2, and synapse with the postganglionic neuron at that level. So it can either synapse at the level of exit or above or below to the level of exit. So yan yung sympathetic chain. There are also sympathetic neuron that goes directly, does not synapse at the sympathetic chain ganglia, but goes out via the splanchnic nerve into the peripheral ganglion. And in the peripheral ganglion, it will synapse with the postganglionic neuron to the effector organ. Okay? So take note of that. Pag hindi siya mag-synapse sa sympathetic chain, it will go out to the splanchnic nerve and synapse in the peripheral ganglion. Now, there is another different activity or pathway of sympathetic neurons, and that is the sympathetic neuron that will synapse at the level of the sympathetic chain, and the postganglionic neuron will go out in the gray ramos and goes back to the spinal nerve. These sympathetic neurons are different. They have a different anatomy and physiology. It will go to the upper extremity and lower extremity. It will not go to the internal organs as most of the sympathetic neurons. So let's just tackle a little bit these sympathetic neurons. So the postganglionic neuron will go out in the gray ramus and joins with the spinal nerve into the upper extremity and lower extremity. This will supply the blood vessels, the smooth muscles in the blood vessels, constricting or vasoconstricting this blood vessel. At the same time, it will also supply the sweat glands and also the piloerector muscle. So take note of these three kasi maganda siyang for exam kasi except o the letter D yung ganon. Okay, so take note of that. They have a different anatomy and they have a different physiology and they have a different effector organs. So this will not come out in your exam, but I'm just trying to show you that the sympathetic fibers in the cord starts from T1 to L2. So T1 generally pass up the sympathetic chain to terminate in the head, T2 in the neck, T3 to T6 in the thorax, T7 to 11 on the abdomen, and T12 to L2 towards the leg. Okay? This will not come out in your exam. I'm just showing you na in the sympathetic chain, they are organized to deliver sympathetic motor output to different parts of the body. Of course, there is no hard and fast rule, but sometimes T2 can supply in the thorax, but generally the sympathetic neurons will go to terminate in the neck. Okay. So again, let's focus on the postganglionic fibers that travel back to the gray rami, through the gray rami back into the spinal nerves. This will supply the upper and lower extremity. It has C fibers that about 8% of the entire spinal nerve. So this is a sympathetic output, the postganglionic parasympathetic output, which will supply the blood vessels, sweat glands, and piloerector muscles. Kakaiba yung pag-travel niya, and that's why we have to memorize this. Even in terms of neurotransmitter, which I will discuss later, it also uses a different neurotransmitter as compared to most of the sympathetic nervous system. Okay, take note of that. The piloerector muscle, sweat gland, and blood vessels, these are parasympathetic postganglionic fibers that travel into the spinal nerve towards upper and lower extremity and supplying the blood vessels, sweat glands, and piloerector muscles of the hair. Okay, another different, this one. The sympathetic nervous system that goes to the adrenal medulla is another peculiar to the sympathetic chain because the preganglionic neuron will not synapse in the sympathetic chain ganglia or in the preganglionic, in the paravertebral ganglion. It will not synapse. It's a first order neuron, a preganglionic neuron lang siya, and then directly to the adrenal medulla. So there is no postganglionic neuron. It is just a preganglionic neuron, then directly to the medulla and stimulate the secretion of epinephrine and norepinephrine. There is no postganglionic neuron. So kakaiba siya. So dalawa yung kakaiba in sympathetic nervous system. The one that goes to the spinal nerve supplying the blood vessels, sweat glands, and piloerector muscle. And another difference is the sympathetic nervous system going into the adrenal medulla because there is no postganglionic neuron, just a preganglionic neuron. So directly preganglionic neuron, first order neuron goes to the adrenal medulla. It will not synapse anywhere in the sympathetic chain ganglia or paravertebral ganglion. It will just go directly to the adrenal medulla and it will stimulate the secretion of epinephrine and norepinephrine. Now, the epinephrine and norepinephrine released in the adrenal medulla, although this molecule, but this effect, this activity, but the pathway is different. This is different because the adrenal medulla will release or secrete epinephrine and norepinephrine into the bloodstream and will go to receptors. Unlike the epinephrine, the norepinephrine in the sympathetic chain, because it's in the vesicles, at the end of terminal end of the neuron, then the neurotransmitter is released towards the second order neuron or the effector organ, to the effector organ, not the second order neuron, sorry, to the effector organ. So the norepinephrine in the sympathetic chain, in the sympathetic nervous system, is reabsorbed. Parang they are not, most of these are not destroyed. They are just reabsorbed. They are just in the sympathetic nervous system. Unlike this epinephrine or epinephrine, this released in the adrenal medulla, it is secreted into the bloodstream and then destroyed. Its effect is only 5 to 10 times. Okay, 5 to 10 times lang, or baka ganun lang siya. So just not very long, but it will not last long, but longer than the effect of norepinephrine in the sympathetic chain. I hope you are able to understand that. So these norepinephrine and epinephrine are released in the adrenal medulla, longer effects as compared to the norepinephrine in the sympathetic nervous system. Okay? Okay. So, parasympathetic nervous system, ganun din. It has both preganglionic neuron and postganglionic neuron. And the preganglionic fibers arises in cranial nerves 3, 7, 9, and 10, so 1973. And then some of the preganglionic fiber also arises in S2 to S4, but there can some of the preganglionic fiber is arising in S1, but most are in S2 to S4 only. Okay, so this will synapse with the postganglionic fiber, kung saan man siya. For example, cranial nerve 3, there is ciliary ganglion, which supplies the ciliary muscle and the pupillary sphincter. Cranial nerve 7, we have the sphenopalatine ganglion, and which will stimulate the lacrimal and nasal gland. And cranial nerve 7 also has submandibular ganglion, which will stimulate the submandibular gland. There is also the otic ganglion, which supplies the parotid gland, and also we have the vagus nerve, which almost 75% of the parasympathetic activity is coming from the vagus nerve. Kaya nga minsan, they call the parasympathetic nervous system as a vagal activity only, kasi almost 75% of activity of the parasympathetic nervous system is through the vagus nerve. It can supply a lot of organs from the heart, stomach, yung gallbladder, liver, name it. Lahat ng mga pambupis, vagus nerve yon. Liver, ano pa ba? M15, lahat yan supplied by the vagus nerve. And some in the sacral output goes to the anal sphincter, bladder, detrusor, and trigone. Okay. So postganglionic fibers can either originate again in the ciliary ganglion to the pupillary sphincters or ciliary muscle, that's cranial nerve 3, sphenopalatine ganglion to the lacrimal gland, submandibular ganglion to the salivary gland, and then otic ganglion to the parotid gland. And most, again, of the activities of the parasympathetic is through the vagus nerve, and then some of the pelvic organs is supplied by the S2 to S4, sacral S2 to S4. All right, so let's look at the differences in terms of somatic nervous system versus the parasympathetic and sympathetic. So kung tinatawag nating somatic nervous system, this is the, let's say, corticospinal tract supplying the skeletal muscles. One order neuron lang siya. Once it exits into the spinal cord, it's just one neuron and it uses acetylcholine. Whereas parasympathetic, the preganglionic neuron is long, and postganglionic neuron short. Kasi nga, the ganglion in the parasympathetic nervous system is very near to the organ that has to be supplied. Whereas sympathetic preganglionic neuron is short, kasi it will synapse with the sympathetic chain, whereas the postganglionic neuron is long. So magkaiba siya. So parasympathetic and sympathetic dalawang neuron, preganglionic and postganglionic neuron, where nervous system just one neuron. Yung somatic nervous system, just one order neuron uses acetylcholine, whereas the parasympathetic nervous system, the preganglionic neuron, very long, it uses acetylcholine, and the postganglionic neuron in the parasympathetic nervous system is short. It also uses acetylcholine. Kaya siya tinatawag na cholinergic neuron. The sympathetic nervous system, dalawang order neuron, we have a preganglionic neuron and postganglionic neuron. The preganglionic neuron is short. It uses acetylcholine, most of the time uses acetylcholine, while the postganglionic neuron is very long, and this is opposite to the parasympathetic nervous system, and it uses norepinephrine. Okay pa bang signal? Hello?
Yes, but okay pa.
So the postganglionic neuron of the sympathetic chain, after the sympathetic nervous system, uses norepinephrine. And since it uses norepinephrine, it is called as adrenergic. Kasi nga, the term of norepinephrine is adrenal. Kaya siya tinatawag na adrenergic fibers. Now, there are other differences in the sympathetic nervous system. One, yung the postganglionic neuron that goes to the spinal nerves and supplies the upper extremities and lower extremities, that supplies the blood, the smooth muscle in the blood vessels, the sweat glands, and also the piloerector muscles. These are different because the postganglionic neuron uses not norepinephrine, but acetylcholine as a neurotransmitter. Take note of that. So kakaiba na yung anatomy niya, lumiliko siya sa gira and joins the spinal nerves, and this supplies the blood vessels, the sweat glands, and piloerector muscle. Another difference is that it uses acetylcholine. So in these sympathetic nerve fibers, both the preganglionic and postganglionic fibers uses acetylcholine. Okay? And another difference is that the sympathetic chain that goes to the adrenal medulla, kasi first order neuron lang siya, and that uses acetylcholine. And then in the adrenal medulla, it will now release norepinephrine, but there is no postganglionic neuron. So to summarize all sympathetic and parasympathetic preganglionic nerve fibers uses acetylcholine as a neurotransmitter. All parasympathetic postganglionic nerve fibers also uses acetylcholine. Almost all sympathetic postganglionic nerve fibers uses norepinephrine, and they are called adrenergic. But also, of course, these rules are the postganglionic sympathetic nerve fibers supplying the sweat glands, the piloerector muscles, and the blood vessels because it uses acetylcholine. Okay? Sympathetic preganglionic fiber is shorter than the postganglionic fiber, and the parasympathetic preganglionic fiber is longer than the postganglionic fiber. So parasympathetic and sympathetic has two order neuron. We have the preganglionic and postganglionic, while somatic nervous system just one order neuron. I hope you understand that. So pahirap ng pahirap to, the acetylcholine that are released in the as a neurotransmitter from the vesicles. We have discussed this before. It's in the vesicles in the terminal end. It is released from the vesicles, and through the presence of acetylcholine, once it is released as acetylcholine, it will be reabsorbed back. It will be destroyed through acetylcholinesterase to become a acetate ion plus choline, and they are also reabsorbed back into the vesicles and converted back into acetylcholine through the presence of choline acetyl transferase. It will not come out in your exam. Okay, and also the norepinephrine, how we produce that in the adrenal gland. Tyrosine is hydroxylated to DOPA, and DOPA is decarboxylated to dopamine. Dopamine will now travel through the vesicles, and dopamine through hydroxylation will become norepinephrine and is secreted and stored in the nerve. And in the adrenal medulla, this norepinephrine can be converted into epinephrine through methylation. And actually, 80% of the hormone release in the adrenal medulla is epinephrine, and only 20% is epinephrine. So this time, yung norepinephrine, once it is secreted in the vesicles of the spinal nerve, of the sympathetic nerve, it will be reabsorbed. Almost 80% it will be reuptake. There will be active reuptake into the nerve. But about 10 to 15% it will diffuse away from the synaptic cleft and will be destroyed. It can be destroyed by the monoamine oxidase or catecholamine O methyltransferase, the nerve. So, ganun yung ng norepinephrine and epinephrine. Okay. So, if we talked about the preganglionic and postganglionic neuron, but the postganglionic neuron has to stimulate a certain receptor. Dito na mas nagiging mahirap. Okay, dito na mas nagiging mahirap. Because even if the action potential is delivered through this preganglionic and postganglionic neuron, even if the neurotransmitter, let's say acetylcholine, is released in the parasympathetic postganglionic neuron, it has to stimulate a certain receptor. Because if these receptors are inhibited, wala ding effect si acetylcholine. So when we talk about acetylcholine, the receptors are nicotinic and muscarinic. And this has been discovered because yung muscarinic receptors is taken from the poison in tadpole, yung frog ba? So, tadpole ba? Hindi. Tod. Hindi pala tadpole. Yung frog. So, meron poison, di ba yung frog? Tapos, pag po-poison, it will only inhibit muscarinic receptor. So, acetylcholine will not have an effect on this receptor, but can still affect the nicotinic receptors. Okay? So, it proves to you that there are two receptors. Yung nicotinic receptors naman, through yung nicotine in smoking, can only excite the nicotinic receptors, but not the muscarinic receptors. Kaya there are two receptors in acetylcholine, the nicotinic receptors, which are found in neuronal ganglia or membrane of the ganglia, and also in skeletal muscles. And the muscarinic receptors naman are mostly found in nerve endings, heart, and smooth muscle of the glands and endothelium. Okay. So the adrenergic receptors, and that's using norepinephrine or epinephrine and dopamine. We have three receptors: alpha, which is alpha 1 and alpha 2; beta receptors, which is beta 1, beta 2, and beta 3. Medyo mahirap-hirap na siya because you have to memorize all these alpha 1, alpha 2, beta 1, and beta 2, because there are medicines that affect only these receptors. Also medicines that affect the norepinephrine or epinephrine or acetylcholine, but there are also drugs that affect the receptors, not the neurotransmitter. So norepinephrine is more of alpha receptors, so it can vasoconstrict the vessels, but lesser effect on increasing the heart rate and contractility of the myocardium. Its effect is more on vasoconstricting the blood vessels, so alpha receptors. Whereas epinephrine has more on beta receptors. So when we talk about beta receptors, beta 1 is mostly found in the heart and beta 2 is in the lungs. If I don't know kung paano kang gagawa ng mnemonic, but for me, beta 1 heart is number 1, lung is number 2 lang. Kaya when we talk about beta 1, it's more of the heart. So epinephrine it affects more of the beta receptors more than the alpha receptors. So if you give an epinephrine drug, it will increase the heart rate and the contractility of the myocardium more than increasing the blood pressure. And epinephrine has 5 to 10 times great metabolic effect than norepinephrine. So once you become a doctor, if you inject epinephrine in a patient who have cardiac arrest, and then you check the CBG after that, blood sugar after that, the CBG is high, and that's because epinephrine can also stimulate the liver to produce glucose. It has a 5 to 10 times metabolic effect as compared to that of norepinephrine. Okay? Okay, so all right. So having talked about the neurotransmitter acetylcholine and the neurotransmitter norepinephrine in the postganglionic sympathetic nervous fiber, there are also alpha and beta receptors in the sympathetic nervous system, and nicotinic and muscarinic in the parasympathetic or acetylcholine neurotransmitter. These are now the end effect. If you stimulate either sympathetic or parasympathetic, anong gawin mo? You have to memorize. I'm sorry, you are students kasi, so you have to memorize this table. Kasi di ba, papahirapan kayo ng teacher nyo, kukuha lang dyan, and then except, mga ganun, or papalitan yung increase heart rate, i-decrease yung heart rate. Wala kayong choice. You have to memorize this. But we found a way to memorize it that we can use it clinically, and that is through the fight or flight state. So sympathetic is more on fight or flight, and parasympathetic is more on rest and digestive state. So ganun na lang ang memorize ko ngayon. But as a student, memorize ko yung table. So in order to memorize it, parang there's a story, a patient man who wants to went to the comfort room, iihi siya at mag-defecate, and then biglang there's an alarm na merong sunog. So what will happen after that is the effect of sympathetic activity. One, ano bang mangyayari sa mata? Diba? Do you need to widen the pupil or constrict the pupil? Okay, you need to run. So you have to widen the pupil. Also have to flatten or relax the ciliary muscle in order to flatten the lens, so you will have a far vision. Because you need to see as far as you can to have a clear view where to run. Opposite to that is parasympathetic. It's near vision and pupils become smaller. So what will happen to the heart rate pag tumakbo na yung patient or yung lalaki? The heart rate will increase, the contractility of the myocardium will increase, ganun siya. So fight or flight. So kung tatakbo ka or lalaban ka, if you have to fight or you have to run, your heart rate will increase. In terms of arteries, the arteries, don't be confused. The arteries supplying the skeletal muscles has to vasodilate because you need to run. There will be an increase in blood supply to the skeletal muscles. We have talked about this before. It's different to other smooth muscles because the smooth muscles has to be vasoconstricted because you want to deliver almost all the blood into the skeletal muscle. So the sympathetic activity to the skeletal muscle is causing a vasodilation of the arteries. Salivary glands and all of the abdomen in a fight or flight mechanism will have to decrease all of its function. You will not be salivating when you are running, but you will be sweating. Okay, you will be sweating. And then the lungs, the bronchial muscle has to, nakakaloka na, you are running tapos umatake yung asthma mo, edi maghihingal ka. So dapat, if you are going to run, the bronchial muscle has to relax so that because you will be needing a lot of air, and that's why this muscle has to relax. And yon, so stomach, intestine, all this activity has to decrease in terms of its motility. And even the sphincter in the bladder, the sphincter in the bladder muscle has to relax. It should not contract kasi hindi ka maiihi. The urinary sphincter has to constrict. Again, parang hindi ka maihi. Your anal sphincter has to constrict. So you have to imagine anything that will happen. If you cannot memorize this table, just imagine the fight or flight mechanism. What will happen to that if you are going to fight or if you are going to run away from all these catastrophic events? Then try to imagine what will happen to the sympathetic nervous system. And opposite to that is parasympathetic. Okay, another very good yung palaging lumalabas sa exam is yung ejaculation and erection. So point and shoot, that's my mnemonic. Point and shoot. So if erection, that's point. Erection, that's parasympathetic. Whereas ejaculation, shoot, that is sympathetic. So if you see, if you are in a sexual activity, erection pa lang, that's parasympathetic. And then after that, when the male ejaculates, that's sympathetic. So lumalabas siya sa exam. Okay? Hi. Now we're near to the end of this lecture. These are just examples, and I need you to answer these if you have understood the lecture. What is the effect of norepinephrine on the heart? Is it tachycardia or bradycardia? So norepinephrine, adrenergic, sympathetic, fight or flight. What do you think?
Bradycardia.
Ha?
Bradycardia.
Ano? Kung narinig.
Bradycardia.
Tatakbo ka eh. You are going to run, going to fight. You are going to tachycardia. So yes, it should be tachycardia. So norepinephrine is used in the postganglionic fiber of the sympathetic. So if you stimulate, if you give norepinephrine, then therefore there is an adrenergic activity, a sympathetic activity, and therefore mechanism, then that's tachycardia. Then what is the receptor here in the heart to increase the heart rate? Is it beta 1 or beta 2?
Beta 1.
Right, beta 1. You are stimulating, so it's beta 1 agonist. Take note of that. You are improving, increasing, augmenting, not so beta 1 agonist. How about this one? What is the effect of metoprolol? This time, metoprolol are beta 1 receptor blockers. So it blocks the beta 1 receptor. So even if you have norepinephrine, even if you have acetylcholine, but you have blocked the receptor beta 1, what will be the effect to the heart? Is it bradycardia or tachycardia? You block the
Bradycardia.
right. So we are giving this drug among patients with tachycardia. So we give them metoprolol as a beta blocker. So this does not affect the sympathetic postganglionic burn. Hindi aapektuhan yon. It only blocks the beta 1 receptor. Take note of that. It will cause the bradycardia, even if there is norepinephrine, but because you have blocked the beta 1 receptor, the heart rate will be low. What is the effect of alpha blocker in the blood vessels? So alpha blocker, we have alpha 1 receptors in the blood vessels. These are supplying the skeletal muscles. When you stimulate the alpha receptor, it will cause vasodilation. Tama? It will cause vasodilation. But if you block these alpha receptors, what will happen? Hypertension or hypotension?
Hypertension.
You have blocked the alpha receptors. Sorry, tama bang pagkakasabi ko? Dapat yung alpha receptors, it vasoconstrict. But if you block this alpha receptor, it will cause vasodilation. So hypotension. Sorry. Hypotension dapat. Alpha blocker will cause hypotension. Right? So ulitin ko lang. Alpha receptor, it will cause vasoconstriction of the blood vessel. If you block these alpha receptors, it will cause vasodilation and therefore hypotension. Okay. Ito din yung binibig natin sa patients with benign prostatic hyperplasia. You give this alpha blocker because it will cause the sphincter to relax so the patient can urinate. All right. What is the effect of activating alpha receptors in the small intestine? Increase motility or decrease motility? Nakakaloka, no? Alpha receptor, is it sympathetic or parasympathetic? Hirap. Di ba ang parasympathetic we have muscarinic and nicotinic. Sympathetic we have tatlo yan, alpha, beta, and dopamine receptor. So alpha receptor is more sympathetic. So if you stimulate the alpha receptor,
Decrease motility.
will decrease motility. Because if you stimulate the parasympathetic, yun ang nag-increase ng motility. If you activate sympathetic activity, it will tend to decrease the motility. Ganun ang hirap niya, but wala kayong choice, you have to memorize this. So in order to pass the exam, ngayon pa lang, you answer the question. Ngayon pa lang, you try to analyze na. Because if you start memorizing and then analyze the exam, may stroke yung brain nyo. Okay? Yeah. Asthma. We tend to give medications for asthma. What do you think is the medicine that we should give? Is it an alpha-1, alpha-2, beta-1, beta-2 blocker, or alpha-1, alpha-2, beta-1, or beta-2 agonist?
Activator.
Hello?
Beta-2 blocker.
Beta-2
Alpha, beta,
antagonist.
So, kung beta-2 blocker, I think if you have to choose beta-1 or beta-2, anong pipiliin nyo?
Beta-2.
Right, I agree to that. Beta-2, kasi lungs tayo. So, do you need to bronchoconstrict or do you need to bronchodilate?
Bronchodilate.
Bronchodilate.
You want to bronchodilate, so do you need to block the beta-2 or do you need to activate the beta-2? Ano ba ang effect ng beta-2? Is it if you stimulate beta-2, bronchoconstriction ba siya or bronchodilation? If you have to run, tatakbo ka, anong nangyayari? Magda-bronchoconstrict ka ba o mag-bronchodilate? Tatakbo ka, you are going to run.
Dapat mag-bronchodilate.
Bronchodilate. So the beta-2 has to be stimulated
Activated.
so that, yes, it has to be activated. So the medicine that you are going to give is beta-2 activator or beta-2 agonist. Ito yung mga salbutamol na ninebulize nyo. They are beta-2 agonists. It will stimulate beta-2 receptors so that the bronchial muscle will bronchodilate. Oh, hi, ganun siya. Ganun, on my end, dati nahihilo din ako, na-stroke ako sa pag-analyze, but I am now familiar because I'm now familiar with these medicines because I'm using that every day. So I think experience also helps you. So as a student, what you will do is try to memorize muna and then start analyzing before you go to the exam. Okay? Her. That's the picture of the sympathetic and parasympathetic that I was trying to show you. Again, anatomy in terms of the difference between sympathetic and parasympathetic. Preganglionic neuron in sympathetic is shorter, but longer yung postganglionic. And this is different in opposite to parasympathetic kasi long yung preganglionic and then short yung postganglionic. Preganglionic sympathetic uses acetylcholine, but the postganglionic uses norepinephrine. And then there are some exemptions. The postganglionic neuron supplying the piloerector muscle, sweat glands, and blood vessels uses acetylcholine, and the sympathetic fiber that goes to adrenal gland does not have a postganglionic neuron. The parasympathetic naman, postganglionic neuron and ganglionic neuron, preganglionic and postganglionic na baliktad. Preganglionic and postganglionic fibers uses both acetylcholine. That's why they are adrenergic. And because the postganglionic parasympathetic fiber uses norepinephrine, they are called adrenergic. The parasympathetic has two receptors, muscarinic and nicotinic, whereas the sympathetic fibers has receptors 1 and 2, beta receptors, beta 1, beta 2, beta 3. Never mind the beta 3, just beta 1 and beta 2. Beta 1 more on the heart, beta 2 more on the lungs, and then dopamine receptor. Yay! We're done. Mahirap ba? Mahirap siya. So, sa exam nyo, I think para sa tig sa 10 yan. There are ilang chapters ba yon? 5 chapters, tig 10. Diyos ko dahil 50 items. Oh, nakakaloka. Mag-aral kayo. And then, next Monday, tama? Next Monday, at 10 o'clock, we will talk about cerebral circulation. Napakadali lang siya, maybe about 30 minutes lecture. So, see you on Monday. Question? Hindi naintindihan or naintindihan? Either of the two lang yan. Ay, may nag-message. Good morning lang pala. Okay. Walang question. Ay, baka hindi naintindihan. Going once? Going twice? Thank you very much. I am toxic today. So, ingat kayo. Bye-bye.